Now, it is expected that the president will address the nation soon after top-level meetings with cabinet premiers and advisors on COVID-19. The Eastern Cape is bearing the brunt of the COVID-19 pandemic at this stage, and the spokesperson for the premier of that province is Xoli. He joins us on the line. Also joining us via video link is Madoda Sambatha, the MEC of Health in the Northwest Province. And let me thank you both, gentlemen. Let me start with you, MEC Sambatha in the Northwest Province. Firstly, are you able to confirm for us that the president will address tonight? If not, when do you think he might do that?
Xoli, good afternoon. As I am speaking now, the president is meeting with the National Command Council, including premiers. Now, I may not be able to speculate as the time the president is going to address the nation. And more so that I'm not the presidential spokesperson, but what I know is that he is meeting with the premiers. It's because I should have been having a meeting with the premier by 5, and I was told he's still in the presidential command council with the president.
Yeah.
So as to whether the president will speak when, that's up to presidency.
Yes. No, agreed. I'm simply doing my work of making sure that my contacts are able to verify certain information for us. Let's speak about your province, MEC. My reading, and you'll correct me if I'm wrong, is that your province accounts for at least 1% of active cases around the country. But here is the centrality of my question to you. It's about your province. I think it is both the receiver of people coming from outside, and they may be coming home from the provinces in which they work. On the other hand, it is also a province that sees migration towards other provinces because of the migrant labor force. How do you plan to handle the issue of the management of coronavirus infections at this time?
Thank you very much, Xoli, and your listeners. Remember, I'm sure you have called us at a critical time. If you take the reality, on the 5th of May, our cases were less than 1,000. But on the 5th of June, they jumped closer to 8,000. And that was the contribution of mining industry opening up for workers to come back. Remember, they were coming back from the 5th of June, mine workers. Now, when you are saying our numbers currently contributes less than 1%, it's true. But the danger is when everybody who is not in Nelson Mandela Bay, who is not in Eastern Cape, who is not in KZN, who is not in Gauteng, who is not in Western Cape, assuming that therefore they are out of the red line. If I can tell you, we're still in a red line, though with very minimal cases per day, but for the past 4 days, we've been above 100. That tells you that the second wave, even on us, it's not far. The only issue may be that we're less by numbers. Coming to your question on what we must do, if you ask Mvusi Wekaya Squesha, Eastern Cape, who's with me on the other line, if they read the district development model of OR Tambo, it says OR Tambo of males. Ask yourself, where are the men? They are in Bujanala Platinum District, dominantly in the platinum mines. That's why Bujanala Platinum District in the Northwest, it's the only district that has more men than women in the population, because the population number of our Tambo males, it's in Northwest.
Yeah.
Now, what we are dealing with migrancy of the mining industry.
Yeah.
The first thing that we keep on telling everybody, better don't go anywhere or don't move out of where you are. Postpone until the end of January. So that the message must be that it's a risk to move, whether you are moving to a mall or you are moving to visit friends. For those that would be in the mining industry, we're working very well with the mining industry for awareness for them, if possible, not to go home. But two things will happen. If they come back, they're going to be quarantined. If they come back and they're going to go to work, they're going to be tested. That's what must be known. We will ensure that's done as a basis of eliminating any possibility of having people who might be highly exposed, easily infecting others.
All right, MEC, I'm going to ask you to pause there for a second because you've already prompted him. Mvusi Xoli speaking for the Office of the Premier in the Eastern Cape Province. Mvusi, you've heard the MEC, but I want to ask you this particular question first. Confirm for us if what we are reading in the papers today is indeed true, that the Premier of the Eastern Cape, Oscar Mabuyane, has asked or has written to the President to ask that beaches be closed.
That is true. Good afternoon to you and MEC Sambatha and your viewers. That is true. The main reason for that is because we are seeing increase in numbers in Alfred or Tambo, Amatole, and Nelson Mandela is starting to decline a little bit. But because we are seeing those numbers, we have identified recreational parks and beaches as a point that would give us high number of infections. So they will turn into super spreaders. So to avoid this, we say let's not open the beaches for this festive season and protect lives of people that would be exposed to infections if we were to open them.
So tell us which cities are affected by this decision then, should the President accede?
All the coastal cities, those would be municipalities like Alfredo, because Alfredo has got a coastal side, OR Tambo, Amatole, right up to Kouka, Jeffreys Bay, St. Francis, right up to Tsitsikamma. And the trends, if you look at them, people would come from inland and drive to the coast for a day or two. People would go back home, like Comrade Sambatha is saying, go home from Northwest for holidays and go back. And if you look at those traveling trends, they are a potential spreader of the virus. So if we say if people must go home, they should stay at home and only go out for essentials, not go for any is closed, not go to the beach because we're going to close the beaches.
Yeah.
So all these things are put in place to protect people so that when you go back home, whether in Northwest or Gauteng, you don't travel the virus unknowingly.
Yeah. All right. Mvusi Xoli, I think what you're speaking to is targeted interventions, and clearly you are seeing this as a red flag, the issue that people are going to be going to beaches. And I can also tell the viewers that this is what is being reported about in the KZN province, which also has coastal cities. MEC, let me come back to you in the Northwest. So on the issue of targeted interventions, Mvusi, you are hearing here the Eastern Cape and the kind of measures that they are clear about. From your side, when you say you are appealing to people to not postpone these visits because of this resurgence, people are going to ask, but you're saying to people that they must exercise their conscience, they must exercise what is understood to be a right decision to make, but you are not talking enforcement. What are your targeted interventions in the Northwest in order to prevent the spread of this virus?
Thank you very much, Xoli. Remember, this time the president, when he was lowering the risk level, said it is in your hands. Literally, the president meant that restrictions of movement at level 1 are not stricter than as they were at level 5. Mm-hmm. But the difference here is level 1 of movement and pandemic are not the same. The dangers posed by coronavirus still remain as they were during level 5. What we are therefore saying to our people in the province and therefore South Africans is that South Africans themselves must individually take up ownership of the movement for themselves, but also take up ownership for their health status. It is critical that South Africans don't wait to be policed by a government for them to then do precautionary measures upon which their lives can be preserved. It is out of reality that
MEC,
South Africans, including Northwest people.
Let me ask you to pause there for a moment on that very point, that this is in our hands as South Africans. And it is expected that the president will address the nation soon after top-level meetings with cabinet, the premiers of the provinces and advisors on COVID-19. The Eastern Cape is bearing the brunt of the COVID-19 pandemic at this stage, and Mvusi Kaya, he speaks for the office of the premier in that province. He joins us on the line. We also have the MEC of Health in the Northwest Province, and Madoda Sambatha. You see him on the video line there. Mvusi, let's come to you very quickly. So you've asked the president for this intervention to close the beaches. The argument from the business side is that you are killing tourism, and it's not just beaches that are affected, recreational parks, you've already mentioned them. How are you going to deal with those who are saying that these measures are going to be the death of an industry that's already on its knees?
Look, we think it's not going to affect the tourism industry because we're not closing down the industry. All we're closing down is swimming and congregation of people in the beaches. People would still be able to book hotels in the beachfront, would still be able to go to the parks, and all the beautiful tourism destinations that we have in the province. What we are doing is we're preventing the spread because quite a number of health workers got infected. Law enforcement officers in the province were infected. Today, we've just received news that our health MEC has been infected by COVID-19. And these are people that are in the front line, leading the intervention, providing support to the people of our province. So we're saying to our people, we're working together with the business sector to make sure that people that are accommodated in the hotels, in the B&Bs, continue to be in a safe environment. These hotels have been doing that since the reopening of their trading by national government. So we're saying where you have parks, national parks, for instance, are able to control numbers of people that go in. We have a concern with open recreational parks where there's no control because people will just do as they please. I mean, imagine a person who goes to the beach, goes to swim wearing a mask. What happens to that mask? The mask will go down in no time because of the waves, and people walk around without wearing masks and exposed. This is a decision that we need to take for the good of the people of our province and the people of our country.
MEC, let's come to you. You are a leader in executive authority. Let's talk about the communication that has been employed thus far by government in trying to stop the spread. In the front page of the City Press newspaper today, one of the professors who's part of the advisory council, Professor Prof Fenter, he says, and he uses the word squandered. He says government has actually squandered public trust when it comes to the messaging. And he says it's been incoherent. And in as far as church gatherings or the amount of people that ought to be in a taxi, this is where his focus is, that messaging has been squandered. As government in the Northwest, how do you plan to not squander this second opportunity for you to communicate clearly to your residents there about the dangers of this virus?
Thank you very much. In terms of communication as a province, I can attest to the fact that there's nothing that we have squandered, but also National has not squandered any communication. What appears to be a confusing approach from the people, it's when a risk is lowered, they assume that equally the risk of infections is lowered. Like I'm saying to you, level 1, it's on economic opening of economic activities. It does not mean coronavirus on the risk as a pandemic has dropped. And this one, we must accept it as an element that each one of us has a responsibility of. In our province, though, communication has not been squandered on the basis that there's proper coordination between the Premier's office and Department of Health. And then there's better coordination in terms of the Command Council on the decisions that go out to the people. And if you would accept, provincially, we having what we call as radio simulcast on each week, where we sit in one place, address and go out to all community radio stations. But the issue about communication is that, let's give an example, practical example.
Yes.
The opening up of liquor outlets, everybody knew the communication. But the abuse of liquor, it's individual decisions. The responsibility and how funeral parlors should work, it's known by them. But as to whether they are stricter when they are proceeding with funeral parlors, the matter that people don't want to abide to. South Africans like being policed. They are unable to stand on their own, especially for their health responsibility.
MEC, yours is a mining province. What are the measures there when miners return to work after the festive season? Because the president has yet to communicate. Some people are probably leaving your province as we speak, and they are either taking this virus to wherever they're going or they're going to return with it. What are the measures in mining operations?
In fact, you are correct when you're saying some people may already be leaving, because last time when the president said by 12 o'clock, they were all in Aliwal North, waiting to get out to Eastern Cape. Fact of the matter is, when they leave our province and they come back, we will force them to quarantine for 10 days. Whether they're exposed or not exposed, quarantine is going to be mandatory for them because they would be coming from high-risk areas. Secondly, when they go back to their workplaces, they will be tested. And the reason for them to be tested is that whoever is exposed must never be allowed to extend to others in the workplace, because workplace infections may become too dangerous than others. But what we are also working on provincially is tightening awareness campaign internally in the province, so that we don't assume that all 4 million people of the province are living and going out, yet it's a small minority that is living through mining.
Yeah.
And so that we have, especially during this period before the 25th, have a provincial-wide pamphleteering and communication, and before the first, have the same, so that people keep getting messages of awareness whilst they think that they're in a celebratory mood of festive season.
All
We
right.
better not enjoy festive season than being exposed and therefore expected to deal with risks of a dying population because of exposure, especially to public events, especially to liquor outlets, especially to soccer activities and
MEC,
funerals.
MEC, let me ask you to pause there. Final question to you, Mvusiwekhaya Stwecha. Still on the same question of communication, one of the health experts in one of the newspapers today suggesting that the corporate style of communication has actually not worked. If anything, the provinces, or whether it be municipalities, they need to make use of people that residents in a particular area know and trust. And there is even a suggestion of teachers that ought to be used to try and communicate this language of safety. But I suspect those people will have to be well educated on COVID-19 and its risks. Your province, Mvusi, has squandered this opportunity. In what way, you ask? Well, one person there in that province is actually before courts, if memory serves, because they lied and said they were conducting COVID-19 communication and charging municipalities or invoicing municipalities when it was found out actually that they were not. So corruption. So how do you plan to communicate effectively, but at the same time avoiding the corruption risk?
Look, we have communicated effectively, and I would disagree with anyone who suggests otherwise. The research that was done by GCIS shows that the level of trust of what government communicates is around 71%. The level of trust of health experts, majority who are employed by government, is around 78%. So there is no evidence that we have not communicated. The earlier research done by GCIS showed that a number of people in the province who personalized the fight was high up, above 80%. So we are looking at low areas where we registered low numbers in terms of response that we wanted to get. The dynamic here is that unlike other pandemics that we're dealing with, you are unable to do door-to-door when you're dealing with COVID. So you are left with your mediated communication, with your loud hailing, something that is done by municipalities, done by provincial government departments. This week, we have a truck that we're driving through Nelson Mandela. It's showing educational messages so that we reach out to many people. We've done radio dramas, we've done adverts, we've done social media placement, we've done everything to reach to the people of our province. Now, data shows that majority of the people of our province are using cell phones. Some are using radio, some on social media. So we send our messaging to those platforms, be it to print media's websites and social media platforms. We've employed all the platforms that are there. So we are now dealing with the second wave because people have dropped the guard. They know what is to be done. They know that there's a closing for buying alcohol in the Nelson Mandela. There's this restriction and that. So we are encouraging now people to comply for their own good. So there's no truth in claims that government is not communicating or government has missed communication.
Mvusiwekhaya Stwecha, let me thank you for your time and, of course, the MEC of the Northwest Province. Gentlemen, my thanks to you both. On the one hand, MEC confirming for us that the President at this hour is meeting with his cabinet, and on the other, Mvusiwekhaya Stwecha confirming that beaches, the request from the Eastern Cape is that they be closed whilst at the same time confirming that the health MEC in that province is currently infected with the virus.